Nigeria's federal government's policy on pictorial health warnings is supposed to take the country a step further in compliance with the recommendations of the World Health Organization Framework Convention on Tobacco Control. But the new policy on tobacco companies doing business in the country must include the pictorial health warnings prescribed by the Federal Ministry of Health on all tobacco products manufactured and sold by them in the country. The rules are in conformity with the WHO FCTC Article 11, which mandates parties to implement health warnings occupying at least 50% of the tobacco product principal display areas and suggest or recommend they should contain both pictures and text. Access 24 News caught up with Akimbode Oluwafemi, the Executive Director of Corporate Accountability and Public Participation Africa, CAPA. We asked him to tell us the true state of affairs.
Well, what we were expecting was that the enforcement of graphic head warnings ought to have started since July, but we heard some rumors, as it were, that it was extended till November 23rd. And here we are, the so-called 150 days extension has expired. First and foremost, I must say that extension itself was illegal. It was an act that we thought was procured by the back door. And an example of how the industry, at this time I mean the tobacco industry, has been meddling with the enforcement and implementation of tobacco control law in Nigeria.
Philip Jakpo is the Director of Programs at the Corporate Accountability and Public Participation Africa, CAPA. We asked him what will the policy on pictorial health warnings achieve.
First things first is to know that the pictorial health warnings or graphic health warnings is intended to convey not only text but also pictures on the harms of tobacco. Article 11 of the Framework Convention on Tobacco Control, which Nigeria has signed and ratified, actually mandates parties, and we are the party, to come up with, text and picture warnings on tobacco packs.
Now, what will the new cigarette packs look like?
So the new packs now contain pictograms of what tobacco causes into the body. Before you used to have something like smokers are liable to die young. That doesn't really convey anything. Now we are going to see pictures of cancer, we're going to see pictures of impotence, we're going to see clear pictures of the harms that tobacco products does to the body.
Is there evidence of where this policy worked?
Studies have shown that pictorial health warnings have worked in some countries. It has worked in Canada, I think it has worked in the United States, it has worked in countries like Romania. So it's a model that has been tested and trusted, and for the WHO to recommend that parties take onto that path is a sure sign that it has worked in other places and it can work in our own climate.
What will CAPA do to assist government in pushing the pictorial health warnings policy through?
We will want to provide assistance at the level of public awareness, and in order also to review this policy, to look at what is working, what is not working, and also to expose areas that people are not in compliance with the law, so that the law enforcement agency can move in and ensure that there is total compliance across the country.
Enforcement is very important. So which agencies of government will enforce the pictorial health warnings policy?
The focal organization still remains the Federal Ministry of Health, working collaboratively with organizations like the Federal Competition and Consumer Protection Council, the Standards Organization of Nigeria, the Nigeria Police, the National Security and Civil Defense Corps, NSCDC, are going to work collaboratively
The takeoff of the policy on pictorial health warnings was supposed to be June 23, and then nothing happened. Stakeholders in civil society, including experts like the guys at CAPA, are saying that graphic health messages on the packaging of tobacco products are more effective than text-only warnings, and that images have been shown to increase the awareness of the health risk related to tobacco consumption. They say the time to act is now, as a stitch in time saves 9.